Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer and Associate Professor of Medicine in one of the large medical schools in the United States. Today we're going to look at a recent evidence-based article published in JAMA Ophthalmology, which I have it right here, okay? The title is Melatonin and Risk of Age-Related Macular Degeneration. Now, everybody know now, the melatonin have a lot of good effects, right? I mean, many studies to prevent inflammation and all that. I don't think anybody else looked at the melatonin role in the macular degeneration. When you talk about macular degeneration, a lot of people lose their eyesight when they get older, okay? It's becoming common and common. We don't know what exactly the pathophysiology or like what actually causing. The hypothesis or most of the thought today's world is something called a neovascularization. That means that a lot of new blood vessels can form and then they rupture, become an exudate, and then it affects your vision. Okay, once once the vision is affected, there's nothing you can do. And everybody, what are they scared of? You don't want to lose your vision, right? Once your vision gone, I think your quality of life is going to go down. You can live if you don't hear, that's not a big issue. But if you cannot see, that's an issue. So macular degeneration is a very common thing. A lot of people end up losing their sight as it's kind of related to aging. So this study, published in JAMA Ophthalmology, looked at can melatonin prevent macular degeneration. Okay, so first of all, we need to acknowledge the people who are behind the study. It's take a lot of effort and time. So I'm going to acknowledge primary author Hejin Jeong, Jacqueline Shala, Jonathan Marco, Catherine Talcott, and the senior author Rishi P. Singh. Okay, and he was coming from Case Western Reserve University of Medicine in Cleveland, so from great institution. And if you have questions, you can always reach out to Rishi Singh since he's the senior author on this case. So let's go into details about this study and see what we can learn, what are the strengths of this study and all that. Okay, so we talk about macular degeneration. We talk about melatonin, the cheapest. You can get it from the over-the-counter. Most people take it because it is going to affect their sleep, and everybody know by taking it natural and those kind of things kind of help them to get sleep. That's what people, when you talk about melatonin, everybody's like, hey, you having sleep problem? Is that what you're talking? But let's look at the other side effect. So if you look at this study, this is a retrospective study. That means you have to go back and you have to find a database or anywhere. So they have this database called TriNext database, which I never heard about it, but I looked it up. It's a lot of information, large number of patients. You can go into your ICD code for each definition, pull up the variables and come with your hypothesis and you get testing, okay? So they have they took people from macular degeneration or older people and put in one group with melatonin, one group no melatonin, and then look at it. So how many patients in this study? Again, 121,523 patients, greater than 50 years old. We know there's a relationship with the age. Put it into two groups, no history of AMD and non-exudative AMD, and then kind of watch them for 14 years and see these people developed macular degeneration. And they also looked at greater than 50, greater than 60, and greater than 70. Okay. Look at any study. When you analyze the study, always look at the statistic. Did they calculate the sample size, or did they use the power and all of that too? Since a retrospective study going back, I think still they could have done looking at the sample size and all of that. This large number of patients, they did adjust for some of them, and they did like a logistic regression. and to calculate a confidence interval come to it. It's a pretty decent statistical study. I wouldn't say the greatest because I didn't see like a sample size. So I did not see the power of the study. You can still calculate retrospective what number to need. But again, a large number of patients are noted in the study. Okay. Now, they looked at the study and they looked at the people with the melatonin, look at the age-related macular degeneration, and look at this amazing results. Okay, anytime when you see the study, you look at the confidence interval. Look at the confidence interval on this. It's very, I mean, it is between, I mean, it's way below 1, right? I mean, if it is anytime confidence interval 1, you know that's not significant. So if it's greater than 50, the risk ratio is like 0.42, and then it's like between 0.28, 0.62. And look at, you know, when you have the diagrammatic approach also, it's way below 1. So it's the results are like really, really good. I have not seen a study with so much significant result. Okay. Now, if we look at risk of exudative age-related macular degeneration patient with the history of non-exudative AMD, they also looked at it. Amazing results. So these are the people who already have beginning of AMD, and then they go into the worst prognosis, and can melatonin stop that? Again, you got the greatest results. You look at the risk ratio, look at the confidence interval, then very narrow, and look at the graph, and then you got the risk ratio is like less than 1, and so it's excellent results over here when you look at it. So very, very important results up here with the confidence interval. Okay, so now when we already find the results. Now we have to look at what are the strength of study, to analyze, I would definitely, when I look at the study, let me see, what are the length of the study, okay? From my standpoint, the strength is, it's a huge database of retrospective study. Look at the patient, there's 121,000 patients in there. It's very hard to get patients like this and do a study. Unfortunately, you have to use retrospective study, but the large number of patients kind of make a huge difference. I'm a big fan of large number. When you have like a large number of patients and you see the effect. Some people may criticize me, but even if there's no statistical difference, when I see a large number of studies and there is an effect, I'm kind of like, hey, I'm going to follow this. Don't ask me why. That's my personal opinion. Again, statistics also very, very important, okay? Unique study, right? This is when you talk about, who thought about this study? These people come up with the role, if they didn't look at it, they couldn't have found it. So hats off to the authors for coming with the uniqueness. And again, we already said it's a unique study. And then you look at the sponsor, no drug companies involved. Anytime I see the drug companies, I just kind of get turned off, because for drug company, the motto is greed is good. Just like the movie Wall Street, forgot the actor, but the main theme in that movie, Wall Street, I don't know how many of you watch it, greed is good, but that's not the case. Be careful when a drug company make it. They're good studies. If you don't, I think it's a topic we all need to discuss, right? Not every study done by the drug companies is bad. I'm not saying that. Otherwise, who's going to do the drug study? Nobody will. The government don't have the money. You don't have the money. I don't have the money. So somebody has to do the study. Only drug companies can come up because they have the money and they have to make money. So it's always a difficult question when I look at the study. Is it a drug company? Should I completely avoid it? No, I would never say that. But you have to also look at it to make sure the authors are good statistical analysis, good ethics were used. That's what I wanted to say. Okay? So every study you look at it, just don't put the drug companies down. And I'm not against drug companies. I think they do a tremendous job. If they're not here, people always say, drug costs too much, but who make the drug? And it's a lot of involvement, a lot of time. Any drug, to come to the market, it can take 10 to 15 years, right? And who's going to fund all these people to working on this drug? the US government is going to do. You think the third world country people will do? Nobody will do. So we need the drug companies to step up, but follow the ethics to make sure. Sometimes when we see like some of the authors, they get sponsorship. I'm just kind of worried about the authors to make sure, they are following. That's the approach we should take. But again, in this thing, there are those non-drug companies involved. Again, they followed up for 15 years in this study. That's also a good thing, because macular degeneration and age-related kind of thing. They also looked at this people already with AMD and the progression from non-exudative to exudative, right? So even though they looked at who didn't develop AMD, they also looked at people who has AMD and they progress to the next level, okay? And then melatonin, I think they also found out melatonin is like this. Some studies have shown maybe melatonin have increased risk of head injuries and all that. But in this study, they did not find that relationship. That's also good. Again, statistical studies, okay. Logistic regression was used, okay. Now, when you look at it, let's look at the limitation, right? The limitations is still, anytime retrospective study, that's a big limitation, right? But again, it's a large number. Who else is going to do a randomized control study? You have to go with the retrospective study, even though it's weakness. It's a little bit of weakness, retrospective. But I cannot ignore with the positivity, the strength. When you look at the confidence interval studies, like amazing results. Okay, such a strong relationship, even if retrospective. I would be, I would be very hesitant not to listen to the study. This study is good, my friend. The relationship, that's what is very, very good when you look at the study, okay? Melatonin dose is also important. We don't know how much dose they use, 5 milligram, 10 milligram. Where did they get the melatonin? Which brand name they used? And all of this somebody need to know, right? You cannot say they use melatonin. I didn't see like which brand they used, because so many companies can make it, and some of the third world countries or like somewhere where cheap they make, they might not use the correct ingredient in there. If they use the, when I look at it in the US, there's like, it's very strict guidelines, right? So anytime the drug is manufactured in the US, I feel safe. Maybe I am biased, I don't know, but I believe the system, right? But I don't have that confidence, some of the I don't want to name the countries, third world countries where the strict guidelines not followed, right? So you have a huge impact. They should have kind of let us know and all of that too. And the other thing I found is interesting, any study, when you look at this, right? I'm up here. When I just kind of look at every study, I see a huge table of the demographic variables. I don't know why they didn't put it. It's very, very important. They said they matched the cases and control. A demographic table is very, very important. I don't care if you need to take more time, but come on, others, the rules. Put it on the first, second page. All this demographic people can take a look at. Don't let it happen again, okay? Now, it has to adjust for a lot more other variables could have played. They did not adjust for multivitamins. So studies have shown vitamin A, C, E, they can also prevent macular degeneration. So if you don't adjust for it, that's not good. The family history, weight, and all of this multi variables can affect it, but the study strength is so good, so huge. I don't care they didn't adjust it, but I'm just telling that's a weakness. And again, this is more mainly for U.S. population, but we don't know what other people again. So this study is huge benefit. It's not hurting. I would recommend people based on the study. Melatonin is not that toxic. Again, when you look at our title, Nighttime Hero, how melatonin can protect your eye, because when you become blind, there won't be anybody there to help you out. You are on your own. So you need to prevent it from happening. Okay? So listen to the studies, watch our channel so we can keep information to you. And a big salute to Nighttime Hero Melatonin. Thanks so much for watching. Bye.